We now have, we'll be able to go until 4:45 for questions and answers before we take a 10-minute break. So I'd like to open it up to those who would like to discuss this as we talk about the bilateral programs and the transitions. For questions. Yes, Scott.
Thank you, Ambassador Lang. Thank you both of the ambassadors and USAID and Japan and others. I'm Scott Ratson. I've been engaged with, frankly, each of your organizations, formerly at USAID when Elaine was there. Sorry I missed her today. And also both PEPFAR, UN Foundation, and others. And the question I'd like to ask, and I want to thank you for fostering the word evidence-based and the need for science advancing what we're attempting to do in global health. And over the years, this fits very well with the ethics discussion when we think only 30 years ago we couldn't say condom on television. We had discussion at the Agency of International Development before male circumcision was accepted and then supported. And now we're in a different era of trying to think about the ethics that we heard before of research, and frankly the ethics was on clinical research, and as I understood it, maybe not on the social science type of research and activity. So the question I have is, everybody here has fostered the importance of partnerships. And I've been at 2 big private sector companies, and we've been able to foster on a one-off basis with different institutions, including HHS. When I was on the CDC board, it was clear CDC didn't partner. They did it through their foundation, so it was a funding piece. So all the different U.S. agencies have different ways of working with the private sector, some of which are such a barrier that people on our committee and others will not, or companies may not, engage in ways that perhaps they could. So my question is since this is a forum and our hope is that we can help foster progress in the areas that we're all trying to work together on, global health diplomacy, what do you think this group may be able to do in terms of helping foster easier ways of engagement to develop partnerships in an ongoing basis? And then the second piece, how we can demonstrate those through a science-based or evidence-based process. They're evaluated in a way, it's not just how much money was given, but it's the impact that they had. And if we generally, if private sector pays for the evaluation themselves, they say, well, that's not real because you paid for it, right? It's So can you help us figure out a way to make the investment, have the health impact, demonstrate the success? And I could talk about a variety of examples, but I don't want to presage that with the kind of work that I think many of us are trying to do.
Other questions? We'll take a round of questions before we. Yes, Kate Dotson.
Hi, Kate Dotson with the UN Foundation. Perhaps a slightly different angle on Scott's good question. I wanted to ask Carrie if you could talk a little bit more about the new emerging global health private sector engagement strategy at USAID, how it may be reflecting some of the lessons learned, pain points of past partnership, what, if you have any specific ambition for the future that you could reference with regards to the private sector engagement strategy in particular, that'd be really helpful.
Anyone else? Yes, please.
I have a question specifically for Ambassador Birx. Your statement on getting to very disaggregated data, site-specific data, is very important. And the question is, if you are transitioning out of countries, do you take into consideration that those data should be produced by those countries in order to sustain transition? And in short, what is being done to make sure that that metric capacity that also AID brings in and others is being transferred to the country so they can maintain monitoring and evaluation properly?
Okay, why don't we do then a round of answers to those? Debbie, you want to start?
Great. So I'll mention just quickly on the private sector engagement. So PEPFAR was known for doing a lot of public-private partnerships. About 4 years ago, we switched that up to make them very intentional and really put out there a problem that we felt we couldn't address at the public sector. and bringing in private sector partners who wanted to address that problem directly with us. And I think one of them was accelerating children's treatment, and a group came that helped us with that. Another huge one was DREAMS, Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Young Women, which really is having its huge impact, only structural primarily interventions on young women's lives and decreasing incidence. The interesting thing about that is they brought their talent base. It was not money. We weren't looking for money. We were looking for their intellect, because they knew how to do market segmentation. They knew how to sell things to young women, and we wanted to sell a prevention product to young women. And so they were extraordinarily helpful. On the other side, the companies said to us that they appreciated that because it recognized that they were also in it to support us in decreasing the HIV incidence of young women, but it also helped bring their brand to Africa in a new way. And so I think we have to recognize that there are companies out there who want to work in particular sectors and areas, and there's an intersection of interest that I think is really important. What is not helpful, and I'm just going to be very frank, it's not helpful for a company to bring their foundation people, because we already have that. That's what we have. We have foundation people. I mean, that's what we have. We have global health people. We want your company people. We want your company people that know how to do things and leapfrog in a new way. And so we're very intentional about working with the company and the corporate structure, because they bring something new to the table. I think if you want to work with foundations and you want a financial relationship, that's fine. But if you really want their leapfrogging innovation that we didn't have, and I think so it's two very different things. And so I think it really matters what kind of partnership you're trying to actually make. The M&E and country-specific data. Again, I'll be very honest. The fact that we are still doing demographic health surveys with a for-profit organization 50 years later or 40 years later means that we have not built enough in-country capacity to do that. And we're paying the price now when we put these surveys out there. And so what we're trying to do within our program is do surveys frequently enough that ministers of health can maintain their staff, which are extraordinary, and a field team that can answer any question. Because it's not helpful to rehire the field team each time. They're extraordinary community members that could do one survey after another. So I think all of us that are funding surveys need to come together. Yes, we're working on the data systems, but I think these long-term epidemiology and surveillance pieces are really extraordinarily important. And to understand NCDs, we really want and need countries to have that long-term capacity. And yes, some of it could be used for research, but I think this M&E and survey capacity is really extraordinarily important for disease outbreak, but also for really understanding the health of the citizens down to the site level.
So thanks for the question. I would also note that, USAID has been doing public-private partnerships for decades as well. I think, as my colleague from JICA, I think the slide is still up there, and the last bullet is so relevant and pertinent and echoes what Debbie just mentioned, that we're really looking for that technical company corporate capacity and skill set. And for instance, Project Last Mile, we had people working in South Africa where I was last that really brought that company logistics, distribution expertise to bear on some of the issues we were facing. I did want to mention when I was making the remarks, we do have one of the Global Health Bureau's leading experts on public-private partnerships, Amy Lynn, who you'll be hearing from tomorrow from our Center for Impact and Innovation. And I don't know if you want to touch briefly on the pain points question and sort of priorities, and I don't know if you need a mic.
Sure. I can just project, but thank you very much.
No, the room goes way back there.
Not allowed. All right. Instead of projecting, we'll use this microphone. Thank you, Carrie. And I think we've been really thinking about this a lot inside the agency, not just for global health, but for across sectors, for every area that the agency works in. And we're trying to think about what can we learn from projects like Project Last Mile and the Coca-Cola partnership, but also others like the Aspen Management Partnership for Health, where we're bringing together different kinds of expertise and seconding them inside ministries of health to help them think through financing strategies and community health worker possibilities. But I think some of the lessons learned is that we need to speak the same language. So to your question of what have we learned from those experiences and what more can we do, we've recognized that we need to equip all of our teams with the knowledge of what the private sector is looking for. They are not a purse string that they're looking to just put money on the table. They do want to bring their expertise. They want to bring their company people, as Ambassador Birx mentioned. And we want to draw on that different type of resources and not just think about them as a new source of funding. I think the other piece to think about is some of the change management that we need to do inside USAID as well. And that's a piece that the administrators really taken on to think through what do we need to change about our policies, our expectations for our field staff, our goals, our goal setting, our strategies, et cetera, and how do we make all of that reaffirm and incentivize more creative and more strategic and more proactive partnerships so that everybody is helping think through where opportunities might be, and then we can fully take advantage of them. And the last thing I would just note is when we say partnerships, we don't just mean the large multinational companies like a Coca-Cola or a Pfizer or a GlaxoSmithKline. We're also thinking about in-country for-profit channels so that we can reach new types of customers. We heard Ambassador Birx mention earlier, we're not reaching men or young people as effectively as we could because they're not always coming to the public health channels that we are focusing on. So how can we think about for-profit pharmacies, clinics, other providers that offer different types of services with possibly more confidentiality or other types of benefits that might attract these audiences? So we're thinking about in-country for-profit sectors, we're thinking about multinationals, and what we need to do internally to be candid about our strengths and our limitations so that we're better situated to take advantage of those partnership opportunities.
Thank you very much. About the evidence-based the practice or the policy development or the program implementation. I think many organizations and even the partnership is now more sensitive or aware or trying to increase or improve the accountability framework, which includes the monitoring and evaluation of the input or the outcomes. So I think it's becoming more a better situation. But I think challenge is what we should really measure in terms of impact and how we relate it to the inputs. I think some of the programs like HIV and ART is very straightforward. That maybe the increase in the ART coverage is contributing to the decrease in the infection rate or something like that. I think it's relatively straightforward. But take, for example, the reduction in the child mortality. I think there are a lot of changes outside the health sector is also contributing to the changes. And are we really measuring what we are supposed to measuring? I think that's the kind of the question we all have to ask. Otherwise, we may describe, kind of prescribe wrong prescriptions based on the wrong understanding of the situation. So I think there's a little bit of a challenge there. But I think in general, the situation is improving. The sustainability of a measurement capacity of countries, I think this is also a challenge. One of the areas that we maybe do better, I think, is invest more on the data use, because if the data is not used and operationalized, I think there is little incentive for the government to first to invest in the data collection, and because there is no awareness about the importance of them. So I think what we can, and also that's what we are actually trying to do, working with the capacity development of the government to use data for their own decision making. I think that was one of the areas that we may be able to support, kind of indirectly, to strengthen or improve the sustainability of a measurement capacity of the recipient countries. Yes. Thank you.
Thank you. Any last comments by anyone? Okay, thank you very much. I'm sorry we don't have more time, but we will have to cut it short at this point. I think for all of us this was quite enlightening, and it's really given us a different perspective on the transitions from the multilateral session that we had earlier, and it was also very helpful to have the discussion of the power asymmetry, which is another factor in how we look to these transitions, and particularly when it's in the bilateral sense of one country giving to another. Very, very helpful. I want to thank the panel. Appreciate it very much.